Now let's turn back to our experts for a moment. And Adrian, picking up on something you were just discussing, while the situation varies from state to state and even within states from county to county, oftentimes, if someone's having a problem getting a vaccine appointment locally, can you give us some best practices on what steps they should take?
Sure. So you're right. Things vary a great deal. And, we, in some ways, have had to build the plane while flying it once the vaccines were available, making sure that the system was working well. And there are definitely things that continue to be done to improve the system. It's not there yet. I think the key piece is using the resources like you just mentioned, the state health department websites, as well as what you all have been putting together at AARP. That's a really amazing resource. Reaching out to your local health department or your county. If you do have access to the internet, most of them have a box around COVID-19 or COVID-19 vaccination. And depending upon where you are, that can be a really great resource to help put you on a list locally. The retail pharmacy program that I mentioned to the last caller, that's another place to be looking because the additional vaccines are being put into that every single week. And so states determined which pharmacy chains to partner with within the state. And so as more vaccine gets sent out, more locations should have access to that. We also recognize that not every community has a retail pharmacy. And, we hope that that's not a barrier. And so really the local health department likely is the place for you to turn. That being said, we do have some challenges with local health departments don't always have the information that they need from the state level to really know what's going on just within your county or within your city. So looking at both those resources, local and state, is really important.
Okay, thank you very much for that. Dr. Benton, let's turn to you. We've heard from AARP volunteers who are raising grandchildren and how important a topic this is. Um,
Mm.
what do we know about the current vaccines and the new variants from the UK, South Africa, and Brazil? Even with the vaccines, we're going to have to adjust some of our normal activities. We've been doing a lot like grocery shopping. Will a booster shot be needed for this? Actually, I that's a question for
Told
Dr.
that's not
Campbell.
Donna. I don't think
Yeah,
I know about
Dr.
booster
Campbell.
shots.
Doctor, sorry about that. Dr. Campbell, can you address that? Are we going to need a booster shot in the face of all these new variants?
So the short answer, I believe, is yes, and I'll explain that. So there are three what we call variants of concern, and these arose in different parts of the world, including the United Kingdom, South Africa, and Brazil. And the reason that we are concerned about these variants is they have mutations in the part of the coronavirus spike protein where we believe the vaccines exert their protection. And so these variants, because of the mutations they carry, the vaccines are not quite as effective. Now, the vaccines are still effective and still very effective, but not quite as much as when these mutations are not present. And just to give you some comparisons, the vaccines in general with the current the main strain that we have in the U.S., as we've seen with Pfizer and Moderna, there's about 95% efficacy, and that probably drops down to about 85% with the UK variant and down to about 65% with the South African variant. We don't have good data yet on the Brazil variant, but I'd expect it to be similar to the South African variant. So we still have good protection, and that's protection against symptomatic COVID. And importantly, the vaccines retain their protection against severe and critical COVID, the type of COVID that can lead to death. But what we do expect is that the companies who make these vaccines, like Pfizer and Moderna, they've already started developing vaccines that are more effective against the variants. And we expect that those variant vaccines or adjusted vaccines will be used as booster shots, perhaps as early as this fall.
Okay, thanks for that, Dr. Campbell. And Dr. Benton, let me circle back to you. We've been living under this pandemic for a year, and grandparents are caring for grandchildren and remote learning, and many people are doing the same while caring for older loved ones. How do family caregivers combat burnout and ensure that they're getting a break?
And that has become more difficult because of safety concerns. So we can't, invite a neighbor over like we used to, or pay for respite. Although for some agencies where they've made sure that people have vaccines now, it might be okay for you to reach out to a local agency that might be able to come in for an hour or two so that you can actually just go sleep uninterrupted, but feel like whoever you're caring for is safe during that time. Of course, there's shorter things that you can do. And I really find that during this time, when we, just standing outside of your enclosed house, walk out the door and breathe in the fresh air. Now, it might be too cold in some places. I never know about stores. In California, I can walk out the door a little more days. But just going outside and just breathing in good air. Another thing inside your house, when you have those downtimes, well, maybe somebody is, the kids are there watching school and the other person's taking a nap, take that time to do something that gives you pleasure. And that can be listening to one or two songs. That's 5 minutes of relaxation. Taking time to read a paragraph in a book that you like, or taking a little time to really enjoy some ice cream in the middle of the day. I think, of course, you can eat ice cream any time of day, but do a guilty pleasure thing, like eat some ice cream, get that nice piece of chocolate. So just those are really quick ways to relax, in addition to, if it's safe, having a home health agency come in and help you.
All right, terrific. Thank you for that, Dr. Benton. And thank you for giving us all permission to eat ice cream in the middle of the day. I know we're grateful for
Okay.
that. Dr. Campbell, I want to follow up on a question that came up from one of our callers, and it has to do with the side effects of the second shots from Moderna and Pfizer. What should people expect, generally speaking, and are the side effects a reason not to get the vaccines?
Yeah, so what everyone should expect is the possibility of having either what we call a local injection site reaction, and that means things like pain, redness, swelling at the injection site in the shoulder, or having systemic symptoms. And what we mean by that are flu-like symptoms. So this includes headache, fever, chills, muscle aches, fatigue. These side effects are very common with both the Pfizer and Moderna vaccine, perhaps a little bit less common with the single-dose Johnson & Johnson vaccine. And we know that they occur, when they do occur, it's typically 24 to 48 hours after either the first or second dose of Pfizer and Moderna, but more commonly after the second dose than the first dose. And we know that these are transient. They typically last 24 to 48 hours and go away spontaneously. So people should not be concerned if these side effects happen. As we were discussing with Josephine earlier, if they're really troublesome, you can take some Tylenol, or preferably Tylenol or ibuprofen if needed to reduce the symptoms.
Okay, go ahead.
In answer to your question, they are not a reason, if you've had them after the first dose, they're not a reason not to get the second dose. I would highly recommend that you still proceed with the second dose.
Okay, very good. Thank you very much, Dr. Campbell. And a reminder to our listeners, we know that some folks have had difficulty registering for a vaccine appointment because many of the registration systems are online and they don't have a computer, they don't feel comfortable navigating online. AARP wants to help. We have established an AARP vaccine registration team to assist in these cases. Okay, now it's time to address more of your questions with Dr. Thomas Campbell, Adrian Castellati, and Dr. Donna Benton. Gene, who do we have on the line now?
Our next caller is Marilyn from Missouri.
Hey, Marilyn, welcome to the program. Go ahead with your question.
Thank you very much. My question is concerning allergic reactions and if it's advisable to take the vaccine. Just make it real short history. Of course, this was when I was younger. Was given penicillin and found out after penicillin shot was allergic to it, so they had to give me adrenaline. Then later on, this would have been when I was in my late 20s, ate some gooseberries, of all things, and found out I was allergic to that. Lips swelled up and throat swelled and rash. Had to go to the hospital. They gave me a shot of Benadryl and found out after giving me the shot of Benadryl I was allergic to that. So we had to do adrenaline again. And I was told, never to take penicillin again, never to take Benadryl again. My concern is, after reading everything, that, it states, okay, if you have had allergic reactions, that they will just watch you a little longer. But I guess concern is just watching you, and then if that happens again, then what?
Yeah.
I mean, is it worth the risk to take the vaccine, or?
Well, that's a great question, Marilyn, and it's a question we're getting a lot because people have been allergic to various medicines. Dr. Campbell, what advice would you have for Marilyn and folks in her situation?
Yeah, so allergic reactions do occur after both the Pfizer and Moderna vaccines. I've not seen any data yet for the Johnson & Johnson vaccine. With the Pfizer and Moderna vaccines, the risk of an allergic reaction overall is very low. It's about 2 to maybe 5 in a million. And we do know that people who have had severe allergic reactions, like yourself, are at greater risk of having an allergic reaction from the Pfizer or Moderna vaccine. Now, what I would say is that we have to balance that risk against the risk of COVID. We know that if persons get COVID, they can get severely ill and can be ill for a long period of time if they recover from COVID. And we know that COVID kills people. So what we know about the allergic reactions from the vaccine is when they do occur, they can be treated very easily with epinephrine, which is the medical term for adrenaline. And so what I would advise is that if you do get the vaccine, that you make sure that the site that is giving the vaccine to you has an epinephrine pen, an EpiPen on hand, so that if you did have an allergic reaction, they could treat you very quickly for it. That's certainly what our practice here at my site is. We make sure that we have that EpiPen present in our site when we're giving the vaccine.
And as I understand it, isn't it the protocol to watch people for a certain amount of time after they've been given the vaccine just to make sure they haven't had an allergic reaction?
That's correct. And people who have had an allergic reaction are observed longer. People who have had a history of severe allergic reactions are observed longer than people who do not. But to the caller's point, observation doesn't do that much good if you don't have something to give should an allergic reaction occur. So I think it's important to make sure that the site that is giving the vaccine has an EpiPen on hand in case it's needed.
Okay. Did one of our other panelists want to weigh in on that question?
Yeah, sorry, this is Adrienne Castelletti. It raises also an important point when it comes to public health. So we are continuing to collect people's experiences with side effects and any other potential reactions through if you do have access to a smartphone, CDC has set up V-Safe, so V as in vaccine safe, and it's a way for people to help track the experiences that they have, and that gives us all better data moving forward. So if you are getting your vaccine, ask people about how to enroll in that, and that helps us all as a country move forward knowing better and more about how the vaccines interact with each of us.
Okay. Thanks, both of you, for that. Oh, go ahead. Is that Dr. Benton?
Hi. Yeah, no, I was just going to say the V-Safe is really easy. I have it on my phone, and they send a little text message. It's like 3 questions every day, and you just click, and then you submit, and it's over. And so they send you a reminder. You get it once a day, and I know that it is going into a big database that will give information for all of us to help us in future problems and health issues. So I do encourage people to sign up for the V-Safe. It's very easy if you have a smartphone of any kind.
Okay, thank you very much. Jean, who is our next caller?
Our next question is coming from Facebook, and this one's coming from Michelle, and she's asking, I have registered on the site in my state to receive the vaccine, but now I have no idea what I'm supposed to do next. Are they supposed to send me an email with an appointment, place, and time, or do I just start looking around for appointments?
I guess she didn't say what state she was from.
She did not.
Okay. I wonder, Adrian, if you have any advice for Michelle or folks who may have, pre-registered and are kind of now sitting and waiting.
Yeah. So a couple things. One is I would look back and see if you got an email confirmation to make sure there's not any information in there about next steps. In general, if you are registering or pre-registering, most areas when they're doing that, it is to then reach out to you when an appointment slot is available or time to make your appointment. And different locations are kind of addressing those lists in different ways. So some may be everyone over a certain age. Some may be kind of taking pockets of that and segments of that, depending upon how many vaccines they have coming in. One of the new things that's happening is for a while there, nobody really knew how many vaccines they were going to have until like Friday for Monday. The federal government is now trying to give a more long-term projection, so 3-4 weeks, which is long-term in this world. And then hopefully local health departments then also have that level of projection, although that's not necessarily happening everywhere at this point. But that really allows people to start registering and then booking appointments longer out. A lot of people have been doing very short turnaround appointment times because they don't want to set you up with one and then have to cancel if the vaccine isn't actually available. So again, with more supply coming in, we should be able to be opening more of those slots going forward.
Okay, and I've said it before, I'll say it again, that AARP has created state-by-state guides that provide local toll-free numbers so folks like Michelle or others can get on the phone and hopefully talk to a person and ask questions like this. How long should I expect to wait? What has been the supply in my state? You can find that resource at aarp.org/vaccine-info. Okay.
And Bill, one of the things I neglected to mention when someone was asking how to find an appointment is we've just stood up a system called Vaccine Finder, which had already existed, but now we're opening it up to COVID. So currently, Alaska, Tennessee, Indiana, Iowa, Oklahoma, Utah, and New York State are now showing vaccine availability through that system, vaccinefinder.com, and more states should be coming on board in the coming weeks. But for folks in those states, that's another avenue to look and try and find where vaccine is in your community.
And will they alert you if you're registered?
I think that is an option. I'm not sure if it's functional yet. This is the kind of the soft launch happened about a week and a half ago.
I see. Okay. Very good. Jean, who is our next caller?
I have another question coming in from YouTube, actually a couple of questions all around what we discussed before related to Advil, taking Advil after a vaccine. Both Teresa and Barbara asked whether they blunted their vaccine as a result of taking Advil, and they wanted some reassurance about that.
Dr. Campbell?
So as we were discussing with some of the previous questions, there is theoretical concern that ibuprofen, which is the medicine in Advil, could blunt a vaccine response. I emphasize that that is only theoretical, and we don't know for sure whether or not ibuprofen, in fact, affects the efficacy of the COVID vaccines. So I encourage people to not take anything unless they need it, but if you need it and you have to take something, then you can do it. But we don't know for sure whether or not there is any effect. It's been studied in other vaccines, and for the most part, there is not any adverse consequences of taking ibuprofen, but we don't know for sure.
Okay, thank you for that, Dr. Campbell. Who do we have next on the line, Jean?
Our next caller is Cynthia from New York.
Hey, Cynthia, welcome to the program. Go ahead with your question.
My mother and I, because I'm her full-time caregiver, we had the second dose of the Pfizer vaccine on March 3rd. I was just concerned because we found out, I just know that the caregiver that took care of my mom a couple of months ago, she said that she had COVID in January, but she said she's still having a positive result, how long does it last, this positive result? Like, how long should my mother avoid having any contact with her?
So your mom's caregiver in January tested positive for COVID and is still feeling the symptoms of that.
Yeah.
I'm sorry. And so your mom has taken both doses of the Pfizer vaccine, the most recent on the 3rd of March.
Yeah, I also myself too.
And you as well.
Caregiver.
I got it. And so
3rd,
the question is, should your mom or you limit contact with this caregiver?
Yeah, and also she said her children have it, also back in January, and then her mother had it. They all live together. I don't know about her husband, but
Okay. Dr. Campbell, do you have any advice there? And if any of our other panelists want to weigh in, they can.
Yeah, so if I understood the question correctly, it's that the caregiver has had COVID but is still persistently testing positive. What we know is that people will continue to have the virus detected in their nose, in their upper respiratory tract, for sometimes weeks or even months after they've gotten better from the illness. But the ability to transmit the infection is only during the first 10 days. If the person has recovered from COVID, is not feeling sick anymore, and is past that 10 days, then we can have good assurance that they're not infectious to others. The second thing I would say about that, though, is that people who are immunosuppressed, so people who have had organ transplants or have had cancer chemotherapy and have a suppressed immune system, may continue to shed infectious virus for longer periods of time. And in general, we want to have those people quarantine themselves for at least 3 weeks from the time that they start feeling better.
Okay. Very good. And the fact that Cynthia and her mom just got their second doses, about a week ago now, are they still in any danger zone, or should they feel like they can, interact with others, at least in their home?
We recommend that we don't do that until 14 days after this second dose. So in order to get full protection, it requires the body's immune system to have 14 days after the second dose to respond to the vaccine. So in terms of relaxing any restrictions, I would wait for those 14 days. In the meantime, it would be important to continue social distancing and masking in the home.
Okay, thank you. And Dr. Benton, did you want to weigh in on this? I know you work with caregivers quite a bit.
I know I don't have anything to add.
Okay.
But I do understand her hesitation, and I'm glad that she reached out today to get very clear directions on how to keep herself and her mom safe.
Okay. Well, very good. Thank you, Dr. Benton, Dr. Campbell, and Adrian Castellati. Any closing thoughts or recommendations that our listeners should understand most from our conversation today? Dr. Campbell, do you want to start us off?
Yeah, so I think the important points about our conversations around vaccines are that we have 3 vaccines that are very safe and very effective, and that everyone should get vaccinated as soon as they have the chance. We didn't get to this, but there has been some concern amongst African Americans and Hispanic Americans that we don't have enough data on the safety and efficacy of these vaccines in their populations. But in fact, we do, and we know that these vaccines work well for everyone. So everyone should get vaccinated as soon as they can.
Okay, thank you very much for that. Adrian Castellati, any closing thoughts?
Sure, and I definitely agree with everything that was just said. I think kind of taking another step back is, we are in this place, a year plus now into working on this, and hopefully we're seeing a light at the end of the tunnel. But I think it's important to remember that there's a lot of issues, including public health issues, that we haven't really been focusing on for the past year. And so the more that we can support that work, whether we're in pandemic times or not, the better off we'll be, because the folks who've been on the front lines doing this, testing and contact tracing and trying to work with schools and businesses are now leading the vaccine work, and they're going to have a lot to pick up after we get through the pandemic. So hopefully we can, they can continue to support you all, get everyone vaccinated, and then we can continue to support them in the important work they do day in and day out.
Okay, Adrian, thank you very much for that. And Dr. Benton, any closing thoughts or recommendations?
I was just thinking that, it's been a year. We're getting closer to where we'll be into what we're calling our new normal. And as we get vaccinated and we've had our 2 weeks and you feel like you want to get together with people, I kind of want to go back to what Lou had asked is, can he have a card game? And I would say, let's ease back into these social interactions. Maybe start with Go Fish before you get into the poker games.
You think poker's going to raise our stress levels too much? Is that it?
Yeah. We may not know how to react to poker, but let's start with Go Fish.
All right. Well, Lou didn't sound like a Go Fish player to me, but there it is. He's got that advice. Well, thank you all. This has been a really informative discussion. I want to thank each of you for answering our questions. And thank you, our AARP members, volunteers, and listeners for participating in this discussion today. AARP, a nonprofit, nonpartisan organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of this crisis, we're providing information and resources to help older adults and those caring for them protect themselves from the virus and prevent its spread to others while taking care of themselves. All of the resources referenced today, including a recording of today's Q&A event, can be found at aarp.org/coronavirus beginning March 12th, tomorrow. Again, that web address is aarp.org/coronavirus. Go there if your question was not addressed, and you will find the latest updates as well as information created specifically for older adults and family caregivers. We hope you learned something today that can help keep you and your loved ones healthy. Thank you and have a good day. This concludes our call.